right. Welcome to the Dr. Greg Show, November 19th, 2025. So glad that you guys are here. Thank you for being here. Hope you had a good day. Another big day in the news. Another day. The Senate passed the Epstein files, and that was signed by Trump, which was very fast, and also it seems like he is going to do everything in his power to stop that from happening, which is not that surprising. Pengs, you're awesome. Yeah, I think it's pretty obvious that they passed it only because he knows that he can stall it. So he is going to fall on the sword, and he's going to make them all look hilarious. Pangs, you are awesome. 1,128, guys. We are getting up there. I love it every single time. Guys, give it up for Pangs. Here we go in 3, 2, 1. Pangs, good job, man. Appreciate you. Thank you for getting vaccinated. We celebrate every shot, every single time. Every single vaccination means that our public health is doing a little bit better, guys. It's a big one. How's it going, Cher? I know, redhead leftist. I agree. He's going to be using whatever he can to stop it, right? He's going to use whatever he can. If he said 2 + 2 is 5, his supporters would be like, okay. Exactly, Veronica. It is wild. I agree, redheaded leftist. Vaccines save lives. It's a good way of putting it. Vaccines cause adults. Over 50% of kids used to die before vaccines and antibiotics. Vaccines are amazing. They save about 4 million kids' lives a year. 1 million adult lives every year. And the flu, specifically, what Pangs just got vaccinated against, is actually specifically very bad for kids right now. The CDC put out a presser saying that they recommended vaccinations for anyone 6 months and above. So you should definitely get vaccinated for both of them. Flu going around must be rough because the vaccine hit me hard. Yeah, Pangs, exactly. Yeah, this one's hitting little kids really hard. So that's an observant observation you made. All right, guys. Well, we have some stuff to go over. We read the Jeffrey Epstein bill yesterday. We went over that. Veronica, why do people choose not to be vaccinate? Why don't people want it? Veronica, it is hey, 5 minute. It is a couple of things. A lot of them, Veronica, don't believe in germ theory now. So a lot of them don't believe that viruses cause disease. If you can believe that, they think that basically disease is from what you eat and the environment, like microplastics. They don't think that viruses are actually causing people to get sick. So they don't think that viruses are real. So why would you get vaccinated for something that doesn't exist? That's part of it. It's also, a lot of it is this weird, messed up notion of personal liberty that you can't tell me what to do kind of thing, which is insane and wrong and crazy and very dangerous. So like those crazy nutcase holistic people. Yeah, Veronica, that's about 30% of the Republican Party now. So it's unfortunately a growing minority of the Republican Party. Redhead leftist. As an MP, people watch too much YouTube and do not understand research methodology. Exactly, Redhead. I totally agree with you. People are going down these, rabbit holes, not because they choose to go down them, right? They are pushed by these AI algorithms into these ever deep holes that they can't get out of, right? These conspiracies are easier to understand. They're easy to get versus like, would it be easier to understand lab leak as like, oh, isn't it a coincidence that there is a virology lab in the same place that there was an outbreak, versus understanding epidemiology, understanding population genetics, all that kind of stuff. It's very tough. Helen, too many YouTube scientists. Yeah, but not actual scientists on YouTube, Pangs. That is the big problem, right? That is a big problem. Helen, you're amazing. So Helen went to action.drgregshow.com, and that's where we have our templates. That's where we have everything going on, and that's where we are organizing in order to stop these anti-public health bills that are going through. So that is 673, guys. Let's all give it up for Helen. And 3, 2, 1, 673, guys. Good job, Helen. She used the templates that we made. The call and the email templates are all there, guys. You just copy and paste, and we are trying to defeat bills that are removing programs to give vaccines to poor kids. We are trying to tackle bills that are going after quarantine laws, that are trying to stop mRNA vaccine developments from being given. It is very, very dangerous, the amount of momentum that they are getting, and nobody is trying to stop it, and it is very scary. Hi, Sin. How's it going? Look at Helen. That's gorgeous. I love that. Helen's saying it's very easy to do it. And, yeah, I agree. Thank you, guys. Also, guys, thank you and welcome Bare Necessity as our latest mod. Thank you so much, guys. I don't ask my mods to do any actual moderating of content as much as like they are big and important pillars in our community, and Bare Necessity is a leader, and she is an incredible community organizer. So it is awesome to have her in this community, and I appreciate her a lot. So, Michelle, how's it going? Oh, I'm sorry, Redhead. Yeah, I worked as a hospitalist through the COVID. Oh man, yeah, there's a lot of people that with PTSD, going through that. It's not, it wasn't easy, from what I hear from my wife's coworkers and her stories to me. Oh, thank you, Michelle. Wonderful to see you. Thank you for being here. All right, guys. So we are working on making MakeAmericaVaccinated.org. We are creating that organization. It is a non-profit organization that we are creating, guys. An actual 501c4 that is going to be aimed at getting politicians to pledge that they are going to support vaccines, that they are going to actually not try to unwind our vaccines, vaccine access, unwind access to. Thank you, Redhead Leftist. The science around mRNA vaccines, for example, shouldn't be impugned on, because especially considering we're finding awesome things about it, right? We are finding awesome things about the mRNA vaccines, and it's important. It's important to keep that. I mean, the mRNA with lipid nanoparticle carrier technology is going to be the future for gene therapy. Personalized cancer therapies, personalized anything for gene therapy. And if the point is that is the future of the synthetic biology world, the molecular biology world, everything like that. Yeah, thank you guys for all the reposting and the sharing of the live. I really appreciate that. Helps us get going here at the beginning of the stream. I had stage 4 cancer, and immunotherapy was crucial for my cancer-free status. Wow, Michelle, no way. Oh my gosh, I'm so happy for you, Michelle. Wow, that is unbelievably incredible. Guys, give it up for Michelle. That is amazing. Congratulations, Michelle. You are a warrior. Wow, I'm so happy for you. That is so cool, man. Guys, this is what we're talking about. This is what public health matters. Yeah, tenacious, I agree. Trump wants us to give up the future. Yeah. The climate, science, energy, everything. Yeah, tenacious, exactly. It's awful. Like these people don't get vaccines, but they build a custom kid through IVF. That's a good point. That is a good point. That is it is wild to me. But yeah. It was amazing. I did cancer immunotherapy lab research, and now I'm cancer-free because of it. Hey, look at you. That's way cool. That is amazing. Molecular biology is so fun. It is. It's the best. It is very cool. Very cool. Hey, nice. Tenacious. Good job, dude. Got your COVID vaccine. Guys, let's give it up for Tenacious Apprentice. That is another one, guys. 11:29. 11:29 in 3, 2, 1. Oh, no. 11:29, 3, 2, 1. Yes. Good job. Good job, guys. Appreciate you getting vaccinated, getting that done before the travels, before the holidays. That's always a good time. Always a good idea. Get it done. Don't have to think about it again. The ER being able to operate on me while unconscious and without insurance, I'd be long gone. Yeah. I mean, you already trust the medical community in order to do stuff for you. Exactly. Yeah, Pings. Yeah, the flu shot. It's crazy. I mean, if you ever had the flu, it's very rare that I actually get the flu. Mostly, it's just the cold, right? But when you actually get hit with the flu, you're like, oh man, I understand why people actually die from this. This is rough. It's really tough. So awesome, guys. So you got some. We have got some organizing done on Make America Vaccinated Again .org, the actual 501c4 that we're doing. Also, guys, we are going to be putting out, as we build up the organization, some like questionnaires of your skill set. If you're willing to volunteer any hours, if you're willing to help us out at all, we are going to be looking at building it out to get some more volunteers on it. So if you are willing to, please join the Discord. You could go to drgregshow.com, and that is where the link will be. So that is it's a good idea. What kind of volunteer? Yeah, we're gonna be asking for your skill sets. So that's the thing, is that we might we don't know exactly what we need, but as we build out, this is just basically a volunteer list of you putting down your skills and like, hey, this is what I can do. And then if we need someone that does that, we can just we can ping you. That would be a great thing to have. So we're gonna build out the MAVA volunteer list. If that makes sense. I prepare for the flu shot. Homemade chicken noodle soup, real ginger ale. Ooh, that's good, man. That's good. The bark, what's it called with a B? It's like in that little brown and yellow like stuff. You guys know what I'm talking about? It is unbelievably good. I love that stuff. It's what I use for Moscow mules. It's really good. Let's see here. All right, and then we have some. We're gonna go over some other things for in regards to how. Yes. Yeah, guys, that is the best way. The best way that you can get involved is right now going to action.drgregshow.com, doing the emailers, doing the phone calls. We have templates for you guys. If you haven't checked it out, just check it out. Just see what it's like, and we have all the stuff there. I can show it to you right now. If you go to action.drgregshow.com, this is what it is. So there are the tabs on the left are basically what bill it is, and then on the center screen is at the top is kind of like what it is, what bill it is, what we're doing, why we're doing it. And then you have the key contact information right there. And then you have the autocaller script, right? This specific one is actually trying to make mRNA vaccines, or that technology, a bioweapon, being classified as a bioweapon. So we got to stop that. So this is in Minnesota. And honestly, guys, this probably doesn't have that great of a chance of passing, right? But the point is that they need to know our name, right? You try to impugn scientific credibility like this, we're going to be in your email box. We are going to be on your voicemail. Like, you will know and hear about Make America Vaccinated Again. So that's the point. Like, anytime there's a transgression like this, we will be there fighting for public health every single time. DN, how's it going, man? How's it going? Because that's who we are. That's what we do. They will know us. Yes, exactly. Exactly. Expect us. Expect us to be there. Because that's what, guys, let's be honest. That's what they are expecting people to not fight back. Who even knows about this? Who's covering this, right? Who is even covering these bills, these 423 bills? Anyone? Has anyone seen a single bill? I mean, start being talked about in their media, in their local media. Genuinely, I'm actually really curious. Have you guys seen any of these bills? I saw that everyone was talking about Florida, right? That was like something that everyone was kind of like talking about, but then what? As soon as Florida said that they were going to rescind it, everyone was up in arms about it, but then what? Right? It's just nonsense. So there isn't enough pushback here. We have to push back. We have to be the ones that do it, right? That's the thing. If not us, then who? 3 decades ago, the lab bio community leaders had been conservative. Yeah, maybe. Yeah, I mean, that's like what, the late 90s? Yeah, maybe. Exactly, Hazel. They expected a dumbfounded citizenry. Yeah, they're expecting people not to fight back. I mean, this is a lot more than vaccines, guys. This is a lot more than vaccines. This is them dismantling public health as an institution. And it's not okay. This is a lot bigger than vaccines. This is them fighting to harm people and basically siding with viruses over humans. So it's atrocious. Okay. All right, nice. I see someone's checking out the MAVA Action Center right now. Anonymous Panda. Thank you for checking it out, Anonymous Panda. NJ, yes, eugenics, because they are literally deciding for people that you are not allowed to have certain genetic mutations if you're going to exist in the population, right? They're saying if you were born immune compromised, if you have any type of cancer diagnoses and you don't have the ability to have a functioning and appropriate immune system, you're not supposed to be in our society anymore. That's what they say. I say that's BS, and that's not okay. That's not how liberated people live. That's not the freedom that we give people. That is not patriotic to say that you just throw certain people because of genetic mutations into the grinder. As a neurospicy person with agency, I find that so offensive. Yeah, NJ, exactly. Opinion on libertarianism. I mean, I'm opposed to authoritarianism, so I can kind of understand what you're talking about, but I don't think that capitalism can be existing without some type of regulation. So I don't agree with ANCAP at all. Why deplete public health? A decrease in an unwanted population. Yeah, Hazel, exactly. They're trying to choose who goes forward. Lack of universal healthcare. Yeah, thoughts on eugenics influencing why they might want to limit access to healthcare. I mean, Manny, I think a lot of it is RFK Jr. makes money on suing vaccine manufacturers. So he's literally creating a scenario where he's going to be paid out more and more. So that, I mean, that's the thing. He gets kickbacks by referring people to anti-vax lawyers, and then when those anti-vax lawyers sue the pharmaceutical company, he gets a kickback from that. So it is basically the corruption that he alludes to Democrats that they have, right? That they accuse me of having. That's why it's crazy. Why are vaccine injuries not talked about? Yeah, we do. We do. The problem is that people talk about vaccine injuries and not disease injuries from viruses. Why not virus injuries? Ms. Sundberg, do you know what an adverse side effect of measles is? Do you understand what a virus injury is? Hey, what's up? I'm just a Bill. How's it going? I wonder if there's a legal pathway to restricting his ability to do that. Well, Manny, so they are abusing a system that was created in order to make it easier to actually sue pharmaceutical companies. So they are abusing an already existing legal system. I do not. Okay, well that's not a good thing to know. That's not true. You don't know that it's vaccinating your kid led to seizures. That's just what did she have to eat that day? Why aren't you focusing on that? Why aren't you focusing on the things that she ate that day versus the vaccines that she got? It's just you're over, and as a mom, you did the right thing by getting her vaccinated 100%. Because you are trying to mitigate the harms that she was exposed to by getting vaccinated, and that was the right move. So you don't have to find a reason and try to blame game what happened, to your daughter, which is sad, but don't make a bad situation worse by spreading misinformation, and that will also lead to other kids being harmed. So that's why it's not okay. That's never okay. Yeah, that's not true. Just because you have 24 to 48 hours before a vaccine, again, that's not true. You don't know whether or not it's linked to that. Why dismiss a parent when she says there's vaccine caused seizures? Because I'm a scientist, KLR. And that's not how the world works. So, that's what it is. So she's misinformed, and and she's been lied to, and I'm not going to sit here and help, her delusion. I'm going to help try to help her through understanding what actually happened. Yeah, Ms. Sundberg, that you were lied to. Vaccines didn't cause your daughter's seizures. Okay. All right, KLR. Great. Didn't request up. It's great. If you're a PhD scientist, then you would know correlation does not mean causation. You know, it's just, I'm sorry, but this is just not okay. Okay. All right. Again, then you should know better, and that's even more shame on you. If you used to work in biotech and a vaccine, then it's like, that's even worse that you have that opinion. Like, I'm sorry, like, you know, medical doctors that spew disinformation and create and use their position of power in order to lie to people get their medical license taken away for that, because we are giving them the opportunity to be put in a position of power that is now harming people. So we take that away, and we should, and it's not okay for medical, like, physicians to do. Can I ask then, why hasn't she had any since? Well, Mrs. Sundberg, she would still have the antibodies in her system. She would still have the vaccines and everything. Like, you know, it would still be an ongoing problem. Reactions do happen. They're extremely rare, and it's not. Yeah, they're not. Yeah, the KLR. That's not just because. They're not tied to it directly. They're just not. Like, even if they happened within 24 or 48 hours, it's just not how it works. You know, that's just yeah. Food much less likely to cause a reaction. I mean, maybe it was something. Maybe, I mean, you don't know. You have no idea. There's a lot of other things that could do. What are some of the major diseases you should vaccinate, in your opinion? All of them, Miss Sandberg. All of them. Yeah. Okay, KLR, you need to, like, either, like, request stuff and be in chat, or, you know, do it. Hi, user. What's up?
Quick question.
Hi, Ambi. What's up?
Hey, quick question. The NIH is a reliable source, right?
Matters, maybe, sometimes.
Okay, I'm gonna, like, scroll over and tell you the article name, and then you can look it up. What I just found.
Okay.
It's related to what you're talking about.
Okay.
Okay, let me go look at the actual name once. Okay, it's literally just called seizure risk with vaccination. And it January 2nd, 2022. I'm not sure. It's essentially, it's before, I don't want to misspeak. It's essentially saying it's very low, though. Exactly what he's saying. And what happens, what the article is saying is that it causes, like, sometimes children will get, like, fevers.
Mm-hmm.
And so it'll be like I don't want to mispronounce it, but like a febrile seizure or something like that, from having a fever, and not necessarily from the vaccine itself, but from maybe the fever. Michelle, that's a really strange thing to say. I don't know why you're attacking me for my gender identity, but that's a really strange thing to say. Anyways, yeah, so...
yeah, we'll just mute you, Michelle, and then you can figure out how to be nice to people for next stream, okay?
Yeah. But anyways, so I don't know how accurate this is. I just wanted to bring this to your attention.
Okay. Awesome. Okay, thank you. Yeah, okay, thank you. Yeah, febrile. What's the medical term for febrile? I don't know what that is.
I'll hop down now. Thank you.
All right, thank you. No, Michelle. No. Yeah. Yeah. Yeah, sorry, Michelle. She requested us to voice chat too. No, you can watch. You just gotta chill. Not okay. Oh, it's from the fever. Okay, so it's seizures from the fever. Febrile seizure risk after vaccination in children 6 to 23 months. Yeah. I mean, it does exist, guys, right? I mean, but the problem is that you're not comparing it against no risk versus now I have risk because I'm getting a vaccine. You have to understand that the adverse side effect that you are comparing it against is having the disease, right? You're going to have a fever with the measles, right? And will that fever from the measles trigger this same seizure? Yes. So the idea that the vaccine is more dangerous than the disease is nonsense. Is there some type of risk associated with every vaccine? Yes. Right? Yes. But it doesn't mean that you should never vaccinate your kids because of the chance of what's going on. It's okay, Ms. Sundberg. It's better to do this in voice, versus text, right? Yeah, it's always, in being a parent, it is hard to know if you are making the right decision, okay? I understand it is tough and it can be hard to know you're making the right decision. It is always the right decision to vaccinate your child. Every single time. Every single time. Okay? So that's the thing. The decision to vaccinate your child is always the right one. Every single time. Because vaccine side effects is you are comparing the vaccine side effects versus getting the disease. And vaccine side effects are always less dangerous than the disease itself. Every single time. Yeah, exactly, bare necessity. Now Trump is saying don't even take Tylenol for fevers. Yeah, exactly. Okay. I'm a microbiology PhD. Yeah. I'm a doctor of science. Hi, Miss Cake. How's it going?
What are we going to do with the CDC posting about autism vaccines? Have you seen it?
No, what happened?
Oh my God, Dr. Craig, the CDC posted a thing that they're saying that it's wrong to tell people that vaccines don't cause autism because that's not scientifically
that
based.
just came out. Oh my gosh, November 19th. That just came out. Are you serious? The claim vaccines do not cause autism is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. 100% fake. That is not true, guys. That is not true. Oh my gosh. That is wild. Just actual disinformation. I mean, this happened with the lab leak stuff, right? That's the thing, is that the lab leak has been never scientifically proven, and yet it continues to be pushed by this nonsense. And then now this. 1 second. Gosh. So it's so infuriating because you literally have from the White House itself just disinformation. It's same thing with lab leak, right? They did this with the lab leak thing, trying to say that it was that they knew better than all of published science. And here we go.
Right.
This is it. This is here. Studies support a link have been ignored by health authorities. That's just not true. It's just not true, guys. I mean, again,
Yeah,
so
absolutely not true.
we see that all the time. I mean, this is the biggest. Vaccines have been completely studied, guys. We have the stuff there. They're rigorously studied. The biggest one is this, which is the biggest study, 25 years, 1.2 million kids, and there's no link between autism and vaccines. And this is not connected to the FDA. This is not connected to the pharmaceutical companies. This is Denmark as a country deciding on their own in order to do this. So, no, I don't think so, Miss Sundberg. We're identifying SIDS more because we are. It's not
We have
linked
better
to vaccines.
monitoring now for SIDS.
Yeah. This is crazy. The state of infant vaccines. Dude, they have no data to support this, guys. They have no data. From 1999, adverse effects of pertussis and rubella vaccines. Is that what their whole thing is? Just this? Oh my gosh. This is what they were talking about. This is the 2002 study. They can't even, this is the thing, is that they can't even link to the latest one that just came out because it's such a big thing. Oh my gosh. This is wild. Just actual disinformation coming from the from the CDC itself. That is so wild.
Can you imagine being the person working at the CDC who had to write that and click, publish?
That's why so many of them quit. I mean, that's why so many of them aren't.
I swear, if that was my job, I would just be clicking publish and saying, "I'm going to hell right now. I am gonna go to hell for this." Click. If I had to do that, I would just. I don't think I could. I think I'd have to quit.
Yeah, look at this nonsense again. This webpage will be updated with gold standard science that results from the HHS comprehensive assessment of the causes of autism as required by. So they don't have it. It's going to be updated in the future, guys. Even here, they are saying that we don't have it, but it's going to be updated in the future, guys. We'll get it sometime. We'll get it eventually. Just keep coming back to this webpage, and we'll tell you eventually. But it doesn't. We don't have the studies yet. What a joke, dude. And it's always the gold standard science. Guys, whenever you see gold standard science, that is a red herring for what that person doesn't. He does not know what they're talking about. The following as required, because every science, you either have good science or you don't. There is no standards of scientific rigor, right? It's there's good science and then there's bad science. It really is that simple. That is just wild to me.
Yeah, Rapture.
No, I haven't.
I'm so pissed. I'm so I'm just flabbergasted, and they're using my condition to make a big national push to keep people from getting vaccinated, and it's holy cow, no.
Oh, okay. This is their evidence, guys. Approximately 1 in 2 surveyed parents of autistic children believe vaccine played a role in their child's autism, often pointing to the vaccines their child received in the first 6 months of life. Guys, half of those kids would be dead if it wasn't for vaccines. Half of those kids would be dead if it wasn't for antibiotics or vaccines. So the idea that now just based off of vibes, they're going to stop this from it's just so wild to me. They have nothing to base this on. They literally said in there that they're going to report it in the future and that it's going to be a thing, but they don't have it right now. They don't have it.
But they're gonna sow the fear and misinformation that they already know, that they have been torturing people for however many years over vaccines.
Oh man, thanks for bringing this.
This is just so
appreciation.
insulting. Like,
Yeah.
how do you think you can negotiate with a virus?
And the
Like, why do
problem
people
is
think
that
that?
people think that now they think that because he's HHS director, just like how they think Trump is better informed because now that he's president, he has access to all this special information. But now, well, guess what? Yeah, this is where we are. Unfortunately, it is wild, man.
Anyway, that's the big news.
That is, yeah.
Thanks for having me up.
All right, thank you for alerting me. I appreciate it. Hi, no Amos Dreams. Basically, the CDC put out disinformation today. It actually, that's what it is. The rise in autism prevalence since the 1980 correlates with the rise in the number of vaccines given to humans, infants. Oh my gosh, so this is the autism. They just put a data table out? They just put numbers out. PubMed's search was conducted to No way. No way. They just did a PubMed search and then they just put in all the numbers. They just put in numbers into a graph, into a data table, and they think that this is science? What? Do they understand how like statistics and stuff work? This is crazy. For one example, one study found that aluminum adjuvants in vaccines had the highest statistical correlation. Okay, let's check this out. In 2014, okay, a single author, guys, a single author paper. A single author paper, guys. So they just had an opinion, basically, and they just put it out there. Who are they? What's their affiliation? Institute for Arctic and Alpine Research. So, in order to take on the entire medical industry and say none of this is correct, the CDC and RFK is now pointing to a single study by a single author that is from the Institute of Arctic and Alpine Research to go against the entire medical world of all the research science that we have. A single study by a single author from the Institute of Arctic and Alpine Research. That's a real sentence that happened in the world. That is an actual thing that just happened. Like, guys, I mean, I have a PhD. I understand. I am a scientist. I am a doctor. I'm a doctor of science. But you do not need anything in order to combat this. You know what I mean? Like, this is just following. How many times do I have to say it, guys? Following the links that anti-vaxxers send you and just seeing what it is and reading. Just reading yourself. Like, reading is a superpower. They say this so often. Reading is a superpower. Read yourself. Read it for yourself. Understand what's going on. For example, one study. Okay, I just clicked this link right here. And then I was like, what is this? Wow, that's odd. It's a single author paper. That doesn't make any sense. That's very odd. That is very odd. Usually you have a PI, you have like grad students, you have postdocs, you have like a whole research team that's behind you. And then you just click that link for the affiliation. Do you take medical information and medical advice from the Institute of Arctic and Alpine Research versus millions of medical doctors throughout the entire world. How? How are you? How are you going to possibly link in this one study by this one person that's not even... Think about that. That's just insane, dude. Who is Cynthia D. Nevison? Who are you? I will bet that... let's see. Do they have any... Okay, let's see. Any conflicts of interest? They don't list conflicts of interest. Interesting. Open access. Low amount of citations. Conflicts of interest. See, this is there it is, guys. This is it. Seen as an The author is an atmospheric and environmental research scientist at the University of Colorado Boulder. She conducted this study as a volunteer for Safe Minds. The views expressed herein are her own and do not necessarily represent those of the organization. That is a... I need to put this or I'm going to lose my job sentence. Let's see conflicts of interest, guys. Conflicts of interest. Anything? Competing interests. Has been volunteering for the Safe Minds Environmental Research since 2011 after responding to an announcement on their online newsletter seeking to volunteer for atmospheric science background. Safe Minds is a nonprofit organization that does not expect to gain or lose financially from this publication of this paper. What is Safe Minds? Who are these people? Cynthia Nevison. Oh, here we go. Going on. This is it. She's going on the podcast tour, guys. CU experts. Here we go. Let's go. Let's go. Oh, shit. My research interests include the global vaccine reported... Oh, no, never mind, guys. Global biogeochemical cycles of nitrogen, carbon, and oxygen. She has no idea what the fuck she's talking about. Wow. What a shocker. What a shocker, dude. Never posted anything. She doesn't put that anywhere on her own research. Nowhere. She hasn't claimed that at all on her research. She is so embarrassed. She is so scared. But here she is. 2000, the Edit Alla Veridian podcast. Could the incentives of our healthcare system be misplaced, focusing too much on vaccination numbers rather than holistic healthcare for our children? Join us for the compelling discussion with Cynthia Nevison, whose groundbreaking research provides fresh insights into the complex and often controversial relationships between vaccines and autism. 11 months ago. Hour and a half, guys. Buckle up.
We need a new set of incentives that prioritize health rather than just how many vaccines you manage to pump into your patient.
Yeah, we do that. We do that by how many diseases that you have in your body. That's a good indication of health, right? I am free of disease. And she is trying to spread her disease and make people less healthy. That is what that sentence is, and it is shocking, but here it is. Here we go. An environmental air and toxicology researcher telling the entire medical community that they're wrong, and she's advocating for more people to be sick based off of no research that she has done. Before we go through this, since they're going to talk about this entire time, I am very curious. Okay, let's go through it. Arctic and Alpine research. I'm sure they're loving it. Oh my gosh, dude. Are you serious? This is... What in the world is she doing? She's just copy and pasting like words and... What the... She's just posting things. Like, none of this is statistically significant at all. Like, what? What is going on? Michelle, you gotta chill, dude. You gotta chill. It's not okay for what you said to MB. You just gotta chill, okay? You're fine. You got timed out for the live. You're back next time. Don't worry about it, okay? The following birth year cohorts: autism per 1,000 people. Prevalence versus 80. Like, she's just putting two things on a graph. Trends in seafood composition and autism. She's actually doing the thing, guys. She's actually doing the thing, dude. She's actually doing just random thing versus autism. Right? Look at this. Trends in fish composition and autism. Trends in seafood consumption and autism. She's just putting random stuff. Guys, look at this. Look at this. Organic food sales versus autism. Look at that. Look how much organic food sales, they correspond perfectly with autism diagnoses. Look at that. Look at that. What about that correlation, huh? Give me a break, dude. Give me a break. She's just putting random stuff on a graph and expecting it to be scientific. She's trying to hoodwink you. Look at this nonsense, guys. You know what I mean? Like, this is why the peer review process exists, guys. This is why it exists, because you can't throw correlations out like this and make causative claims. Right? You can't do that. And that's why the peer review process curb stomps this stuff every single time. Why they can't actually get a legitimate publication published. It's not because nobody would publish it, right? We publish vaccine safety constantly. The vaccines are constantly studied. It's because they're coming at you with this. It's just random things. Trends in New York City ambient PAH in autism. What? These are just random things. Autism per 100,000 in New York City. Ground level ozone violations. Guys, you have to do statistical analyses in order to understand if these actually correspond. You can't just put things on a graph and say, doesn't this look crazy? Guys, and this, by the way, is gold standard science to them. This is gold standard science, just 70 different graphs that have no correlation whatsoever, but they're just used. And then using this is a really good indicator that you don't know what you're talking about too. We're using way too many works cited, 100 pages, 100 references on something like this. Like, I guarantee you that a lot of these would be misattribution, right? There's a lot of people that wouldn't agree with a lot of this stuff, but they're just pushing it. It's wild, dude. All right, now guess what we're watching tonight, guys? Thank you for bringing this up. Trends in autism compared to trend in U.S. application of glyphosate. Wow, look at that. Wow, it's such a good chart. Who knew would have thought? Wow, wow, glyphosate, which is the Roundup Ready stuff. But wow, guys, look at this. Oh my gosh, what it correlates better? Oh my gosh, autism and organic food sales. Wow. Look at that. Maybe there's a connection. Dun dun dun. Look at this nonsense, guys. She's an awful scientist. She is a really bad scientist. Safe minds is the ultimate goal, is to find truth. Psychotic, dude. They don't even have what an absolute. Look at this. Have safe kids. Yeah, you know what? How I have safe kids? When they're vaccinated and free of disease. What a crazy thought. What, they don't even have a website. They can't even maintain. With Safe Minds, can't even maintain a website, dude. Oh my gosh, dude. Scholar.google. Let's watch this. Let's see. Let's see how even in her own field. No. She doesn't even have. Oh my god, she doesn't even have a Google Scholar, dude. She's petrified. That is wild. That is very weird. CD Nevison. Yeah, she doesn't even have a Google Scholar, guys. That is wild. That's actually insane. This is what a Google Scholar looks like, guys. This is what a Google Scholar looks like. Wow. I don't have an impressive resume for my stuff. You know, I got all my stuff together has gotten 202 citations this year. It's going up. We're on an uptrend, guys. We're on an uptrend. So let's see what the conclusion is, okay? And then we can compare it. She's published papers not in her expertise, right? She has not actually published a paper that's legitimate in this area. She has just put out something that is a hit piece that was, yeah. But this is exactly why this stuff, oh my god, this is crazy. Anyway, the conclusions. Diagnosed autism prevalence has risen dramatically in the U.S. over the last several decades. Okay, diagnosed autism prevalence. Yeah, because we started diagnosing it. That's why, because we actually started diagnosing it, and we started broadening the scope of what it is, and continued to trend upward as of birth year 2005. I wonder what happened in that year. The increase is mainly real. That is gold standard science, ladies and gentlemen. The increase is mainly real. That's actually a scientific sentence that these people are using in order to combat the entire medical field. The increase is mainly real. Wow. It has occurred mostly since the late 1980s. Wow. Mainly real. Wow. In contrast, children's exposure to most of the top 10 toxic compounds has remained flat or decreased over time. Really? Do lead. Do lead in the atmosphere. Is that decreased or flat? Let's say it's flat. Decreased. Definitely decreased. Environmental factors with increasing temporal trends can help suggest hypotheses for drivers of autism that merit further investigation. Why would we assume it was environmental based versus genetic? Right? Why would you assume that they're just only genetic? Only environmental. Like, it's just, what? It's almost like this person has no idea what they're talking about. Oh my god. Let's see if genetics is even mentioned. Genetics. Okay, no, genetically modified corn soy. What? The existence of identifiable inflection point in the autism trend data is important because it would tend to argue against diffuse intergenerational epigenetic explanations and would suggest that the temporal drivers of autism may be fairly specific. What? So the fact that like 1988, 1989 is different, that doesn't make any sense. Again, crops genetic. They're only talking about when they're talking about genes, they're only talking about genetically modified plants. That is it. They're not talking about genes at all. They don't. Oh my god, dude. Oh my god, are you serious? Here we go. Oh, here we go. Interesting. This is in her introduction. Okay, some have argued that autism is primarily genetically based and has always been present in the human population at current levels. What does she have to say about this? From this genetic perspective, temporal trends in autism and toxins are largely irrelevant. I mean, other than like the detection ability to increase, then that would be it. Rather, the rise in autism diagnosis reflects the successful efforts of the public health community to better identify children who went undiagnosed in previous generations, to promote inclusion and acceptance of these children, and to provide them with early intervention services. Okay. Others have argued that autism is caused primarily by environmental triggers acting on a genetically susceptible subset of children, that epigenetics play an important role in mediating how environmental toxins affect gene expression. I mean, we have like twin studies that go against this, right? That's the whole thing. You know, that's why you have that kind of stuff, and it's shown to be more genetic than environmentally triggered. A recent comprehensive study of ASD concordance rates among dizygotic and dizygotic and monozygotic twins support the dominant influence of environmental factors, while also confirming the importance of genetic susceptibility. From this alternative perspective, since genes also do not mutate rapidly, temporal trends in environmental toxins are relevant and can provide valuable clues into the cases of autism. Yeah, we're not seeing the mass mutation of new genetic cases. Like, there will be a point, right, where maybe we are, the accumulation and the change of the umbrella changing and getting wider with the autistic community is going to even out, and we aren't going to have this mass explosion of autism diagnoses, right? At some point, you will have like if that's true, the hypothesis is true, right? There will be some like leveling off. That does happen. We're just at the point now where the umbrella has recently changed, and now we are seeing that point. So we're seeing the accumulation of not just children that are being born with autism, but we are seeing late adult diagnoses, and those are being included as well. So once the adults are counted, once all the kids are counted, then at some age, at some point, we will see like a more gradual and slope that is in accordance with the birth rate. Wow, she spent $2,500,000 on a study that didn't prove a link? What? Wow. She personally did that? Oh, here we go. This is the first. Oh, here we go. This is finally, I am interested in the intersection of agriculture with human and environmental health, in which the same agricultural practices that lead to greenhouse gas emissions, coastal eutrophication, and other environmental damage also contribute to obesity and chronic inflammatory disease in human consumers. She's thinking that chronic inflammatory disease is autism. In other contexts of current agricultural priorities that contradict the advice of nutrition and health experts, I am interested in exploring the large-scale issue of climate, biogeochemistry, and resource consumption involved in shifting U.S. agriculture toward a greater focus on crops that nourish and support human health. Oh my gosh. Wow. What an... I don't... Yeah, I'm sorry. I just... this is so wrong. (1991) Institute of Medicine. Key finding. No data were identified that addresses the question of a relation between vaccination with DPT and other pertussis component in autism. There are no experimental data bearing on a possible biological mechanism. Huh? What? I mean, we've tested it since 1991, dude. Like, what? I mean, we literally find this, though. All this evidence of inadequate to accept the rejectable of the causal relationship between them. Man, they're going after everything. The key findings of the 2012 IOM report and the 2012 report of insufficient evidence associated between autism and Tdap remain unchanged. Dude, why are these are such old studies? At least this one's new. Man, they're coming for all the vaccines, guys. Remember, guys? Remember when it was a bunch of people that were like, "Oh yeah, we're not anti-vax, we're anti this vaccine, guys." Remember that? When they were like, "No, we're not against vaccines. We're just against this vaccine." And everyone was like, "Nah, you're anti-vax." And they're like, "No, I'm not." And then now look what they're going for. MMR. They're going for all of them. Every single infant vaccine. It's just like... it's unbelievable, dude. The HHS will evaluate plausible biological mechanisms between early childhood vaccinations and autism. Mechanisms for further investigations include aluminum adjuvants, risk for certain children with myocarditis disorders. That's something that he learned from podcasts. Harms of neuroinflammation. See, guys, that's what I was talking about. Harms of neuroinflammation. That's the other buzzword, inflammation. Hi, Dr. Mommy. We're going through, welcome in. We are going through the Autism and Vaccines Disinformation page that just landed. You should check it out, Dr. Mommy. You might be asked questions on this. It's insane. The disinformation is coming from inside the house. Here, the header, "Vaccines do not cause autism," has not been removed due to an agreement with the chair of the U.S. Senate Health, Education, Labor, and Pensions Committee that it would remain on the CDC website. That's so funny, dude. That's why it said vaccines do not cause autism with an asterisk. They were forced to do that. It says they were forced to do that by some physician that was like leading the charge. Oh my gosh, how hilarious. How embarrassing for them. So it's not based off of any type of medical information, right? It's not based off of anything that they are doing. It just feels, man. It just feels. Who is the chair? Yeah, Bill Cassidy. Yeah, he's a physician. Yeah, Senator Bill Cassidy he's a physician. So that's why he was like, you can't do that's so crazy. Even a Republican physician's like, guys, you can put out all the disinformation you want as long as it on the headline you say does not cause vaccines do not cause autism. That's fine. You can't take that off, but you can put all the disinformation that you want. that actually happened. That's wild, dude. That is wild. Okay. Yeah, huge asterisk. What a joke, dude. What a joke. What a joke. What a joke. Okay. Okay, what? Guys, are you out of your mind? Are you serious? Are you reading this? Did you guys see that? I just linked. Okay. This is what? Guys, I literally I clicked this link, okay? I clicked the link here. Okay, follow me here. I'm not. This is a 2014 report, right? And I was like, what is this thing that they're doing? They're linking to this healthcare research quality, okay? Boom. I'm like, I click this link, okay? I click this is actually happening. I click the link here, go to the page, main points. Since the prior 2014 Agency for Healthcare Research and Quality report on vaccine safety, we found no new evidence of increased risk of key adverse events following the administration of vaccines that are routinely recommended for adults, children, and pregnant women. We found no new evidence of increased risk of key adverse events. Signals from the prior report remain unchanged for adverse events that include anaphylaxis and febrile seizures. There continues to be no evidence of increased risk of adverse events for vaccines currently recommended to pregnant women. There remains insufficient evidence to draw conclusions about some rare potential adverse events. Even the same things that they are linking on the disinformation side, even the same things that they're... Am I going crazy? They are saying on the pages, on the citations that they are linking, that there is not sufficient evidence in order to draw this. And yet they're linking to it anyway. Yes, exactly, Renee. They're counting on people not paying attention. Exactly. They're just like, wow, that's a lot of links. They must be correct. Wow. Okay, so this is an archive of a 2011 paper. This is for reference purposes only. It was current when it is now outdated. Why would we read something that's 2011 on the current state of vaccines? Guys, I'm just clicking on what they're doing. Why would anyone read these old? They're literally they're linking to archived stuff. National Academies of a Consensus Report archive. Like, why would we? There is no studies that support the claim that any of the 20 doses of the 7 infant vaccines recommended for American children here before the first year of life do not cause autism. Really? No studies? I could have sworn there was this one, the biggest study of all time that was 25 years in the making, 1.2 million kids from Denmark. Oh, yeah. Duh. That's right. That's why RFK tried to have this redacted. That's why he went to the journal trying to get that paper redacted, because he knew that they were coming out with this disinformation, and that paper made them look bad. So that's why he tried to get it redacted when it came out, because he knew that he didn't actually have any information, and he wanted to say that there's no studies to say this, but there is a study, and it's like the biggest study ever, and he tried to get it removed and redacted because he has no actual evidence or studies, or has no idea what's going on. How embarrassing. How embarrassing. Dr. Mommy, MD, there are multiple high-quality studies showing no causal link between the MMR vaccine and autism. Exactly. Thank you, Dr. Mommy. Exactly. And why they hate this one so much? Why did they try to have this thing taken down, right? Why did they do that? Because this is the death knell, right? This is a Denmark-based study where these people are studying our vaccines, not connected to the CDC, not connected to the FDA, not connected to the pharmaceutical companies. This is Denmark paying with their own tax money, their Denmark researchers doing research on Denmark citizens and finding no link here, and it is the biggest study of all time. So it is a complete death knell to the idea that the for-profit pharmaceutical companies are taking care, are lampooning this stuff into our arms, and we don't have any say about it, and we can't have the studies, and there's nothing to say about. You can't actually do your own research on this stuff. Nope. We have it. We have it right here. This is it. This is it right here. How embarrassing. How absolutely embarrassing. Guys, if you are as fired up about this as I am, okay? Use your rage. Use your energy right now. And that's what we're doing to fight this stuff. That's what we're doing to fight this nonsense. Action.drgregshow.com. Please, if you just have never gone there, just please, after this nonsense that was posted today, please, just go there right now and just see what it's like. Okay? We're trying to fight back against this stuff with emails, with phone calls. There's 423 anti-public health bills that are trying to promote disease and illness in our country, and we are trying to stop it. I don't know why no other media follows this. I don't know why nobody else is talking about this. I don't know why anyone else is actually organizing against it, but we are. Okay? We care about public health here. We love public health. And that's why we have to fight back against it. Are you transparent with how much you're paid? Yes. Yes, I am. Okay, so what happens basically is that I get carbon copies. Okay, I get carbon copies sent to me for the invoices. And every time that I go to your mom's house and pleasure her, she gives me an invoice that I have to sign off on with your dad, and then he sees it and then tips me, and then that's so like it's multiple, multiple people are seeing that and signing off on it, and then and then yeah. Oh, he tips me. Yeah. Because her mom has never felt happiness like before, basically. So, I'm very transparent. Thank you for caring about it. Thank you. That's true. There you go. That's happy wife, happy life. Thank you, Mrs. Dr. G. See, there you go, guys. There you go. It's true, bare necessity. That's exactly. It's true. It's transitioned. The community service is what she provides to everyone else. You know what I mean? I kid. Okay, I kid. That was too far. I'm sorry. Okay. All right, guys. We have to respond to this. This one environmental. I am mad personally. I am an ecology undergrad. Ecology is my jam. I love ecology. And the idea that I could somehow write a paper. I guess I'm Trump has taught me a lot. I'll say that. I will say that. Trump has taught me a lot. Trump too has taught me that I am actually qualified to run the HHS, the CDC, all these agencies that I was like looking up to and revering the entire time. I'm like, wow, I'm actually super qualified. And I'm finding out now that with my undergrad degree of ecology, I could have undermined the entire medical field and just, the entire time, I didn't even have to go to grad school to do like the microbiology thing. I was actually completely educated enough to do environmental toxicology correlation studies and the entire time. So that's coming soon, guys. That's coming soon. And then meanwhile, you got people coming in here being like, "Are you qualified to say that?" I am doubly qualified to respond to this, guys. We are doubly qualified. Double qualified. Okay, guys. Now we have to watch this. This is... Dude, who is this? The Edit Aljavarian podcast. Oh my gosh. I'm going to email this person. All right, I'm emailing this person. I'm getting him on. I'm going on there. Dr. Edit that's her name? A marriage and family therapist? Oh my gosh, guys. It's so... Thank you, guys. Yeah, thank you for the hearts. Thank you for everything. Oh my God. Through the empowering episodes, the podcast dedicated to education and guide individuals towards unlocking their full potential. The podcast imparts universal principles in the domains of health and spirituality, fostering personal growth and empowerment among the audience. I'm looking up. Her name is Edit. That's her first name. I mean, I'm sorry, but What was that, Dr. Mummy? Let's see what Dr. Mummy said. Okay. Whenever I see someone's, I want to see their thesis. What do they, edit is such a crazy, unique name. There's no way that I have to be able to find that. Edit, no, it's not. Like, Anna Alivarian, I'm trying to find through Google Scholar her research. Oh, Edith. It is at EDIT. It's not on ProQuest. She just doesn't have a single published paper. God damn it, dude. There's no way this is the real world. There's no way that this is the real world. Guys, it's not prying. It's actually, if you have a PhD, right? You have worked very hard. Okay. This is so, okay. I'm sorry. I'm have to be, okay. If you have a PhD, guys, you have worked extremely hard on that thing. Okay? You have given up countless all-nighters. I did like 7 24-hour stints in the run-up to finishing my thesis in the lab. You know, I worked so hard, and it was like 7 all-nighters in 3 weeks or something. It was insane, getting it all done, getting all the edits done, getting all the reviews, getting all the edits, getting all the extra experiments done, making sure everything is right, double checking everything, writing. You know, you're working so hard, and you become proud of that, right? One, you're actually kind of like, you're the biggest skeptic of your own thesis is yourself, right? Because you kind of like hate it at the first. You do hate it because you're like, this thing sucks. I hate this thing. But then you try to make it better, right? So my point is that at the end, you kind of like, you're proud of it. You're proud of your research. You're proud of your dissertation. You're proud of like showing it off. So it isn't bad. It is not prying. It's actually wanted. If someone was like, oh, I would love to see your dissertation, I'd be like, yo, yeah, thank you. Or like someone asked me, what's my dissertation on? You know, I'm like, what kind of scientist am I? I would love to talk to you about that. I'm a microbiology PhD. I did my PhD on delivering DNA on single-walled carbon nanotubes into algae chloroplasts. And I helped pioneer the field between algae biotechnology and nanotechnology for the first time. I was one of those people that helped pioneer that. I'm extremely proud of that. So it is not prying to ask someone with a PhD, can I read your dissertation? Like, where was your publications? Like, I'm really interested in it. You know, that isn't a bad thing, right? And the fact that like she doesn't have any public knowledge on this, she doesn't have any publications, she doesn't have her dissertation posted anywhere. What? You know what I mean? Like, that's a red flag, guys. That is a red flag. There is nothing more a scientist wants to talk to you about than their own research. You know what I mean? This man inspired me partially to go back for a neuroscience major. Oh, wow, Dylan Ray, me? Oh, thank you, man. Wow. Wow, I'm honored. Thank you. Thank you. I appreciate that. Wow. Truly, that means a lot to me. Thank you. Oh, wow, man. Thank you. That's really cool. So the fact that she's not on ProQuest, it's not on ProQuest. Like, where is this? She has no publications. Edit Alavarian, author and therapist born in Armenia, family marriage therapist and author. She received a master's in marriage therapy in 2018. She's made several appearances on Fox News. That's so frustrating, dude. Oh, wow, Dylan. That's a really nice thing to say. Thank you. Wow. Thank you, man. Thank you, man. Thank you. Dr. D, should we check your heart rate? Just wanted to make sure that you feel your anger. I am, guys, I'm at 66. 66 right now. I'm totally chill. Yeah. This is nothing. This is nothing. Now that I've looked at it, it's at 69. Yeah, Royal. Yeah, Royal Cobra. Let's do it right now. Because I'd rather do it right now than when we're doing the thing. I'm so frustrated. Heart rate? Resting heart rate of 68 is high? I don't think so. I don't think so. What are your thoughts on CRISPR? It's awesome. It's like the next generation, and yeah, it's amazing. Yeah, I thought it was 67 totally normal. Oh, okay. Well, let's do it. Let's do it later then, because it's better to have these conversations in voice, man. Over text, it's kind of tough. But I love having conversations with people and their. Oh my god. The fuck, dude. The fuck, bro. Are you fucking... Nevison has 2 children in BVSD. During the COVID-19 pandemic, she spoke at a school board meeting to oppose vaccines, mask requirements, and quarantines, among other policies. What? Wait, and she's also said she's concerned about the declining enrollment, including the increasing number of parents who nationwide are pulling their kids out of public schools. What? Hey, Roy, what's up? I can't hear you. Oh, you just alt-tabbed?
Oh, hello?
There you are. What's up, man?
Oh, sorry. Can you hear me?
Yeah, what's up? Hey, Amy.
Sorry, I have to be a little bit quiet.
Okay.
But, it's just, something that's been bugging me. I don't know if it's, like, something that you would know about or, like, be interested in.
Okay.
But, it was related to the new Epstein emails.
Okay.
And it's, called it's a project called ASU Origins Project.
ASU Origins Project?
Yeah. Yeah, that, it's ASU News.
This is 2012? Okay.
Yeah. Check them out.
Okay. Cool. Is this just like a place to talk and stuff and have debates and things?
I'm not sure. So from what I've learned, I don't know. Like, there's them, and then there's the other. There's another project that they were. There's like multiple other projects they've been working on. Like, from what I was reading from the emails, like, they were researching like the study of AI and what it theoretically could do, and like they were theoretically studying a bunch of other stuff. A lot of people invested into this project, like Epstein and Donald Trump, and like a lot of other people.
Okay.
And like, I don't know, I just thought it was interesting.
Okay. All right. We'll have to keep a lookout, I guess.
Sorry.
That's okay. I don't know. I don't know what else to say. I don't know.
I've just been like I've just been learning a bunch of other stuff. It's been interesting.
Okay.
But thank you for letting me share.
Okay, cool. Thanks, man. All right. Have a good one.
You too.
Cool. Okay. All right. Let's watch this. Dude, hasn't done anything for 4 months. Hasn't done anything for 4 months. 30,000 views a year ago? Oh, wow. She had her own podcast space and everything, and then she went remote. Oh, here we go. Ugh. Oh my gosh. Well, okay. Okay. All right. Let's do this.
We need metrics of children's health, and we need to reward pediatricians based on, what's the rate of autism in your practice? What's the rate of asthma in your practice? How many children in your practice are on ADHD medication?
So, just to be clear, you're going to be rewarded for having less people that have autism diagnosed in your practice. Is that? I just want to be clear. So, anyone have a problem with this that might foresee there being a problem here? I wonder. I wonder.
The lower the number, the higher their bonus should be.
I see exactly. I told you. I pre-watched this. I pre-watched it, guys. It's my ability to go into the future. It's the vaccines. Okay, stop. This is the real power of vaccines. I'm actually able to go into the future, and it gives me that ability. It's like, it's the magnetic waves that are coming off of me that allow me to be in two places at once, and since space-time is relative, I'm able to space tunnel through into the future and tell you what's happening in the past right now. So anyway, you guys will get there. It's really like fifth booster stuff, but you'll get there, don't worry. God, how can people watch this stuff? How can people watch this stuff, man?
If that were the system, I think things would change quite rapidly.
Like they are just to be clear, guys. They think that They think that physicians are getting paid by pharmaceutical companies, and that's where these diagnosing is coming from. Okay, all right, okay. It's a perverse financial incentive that makes it so physicians diagnose autism because of a perverse financial incentives. Okay, catch this though. The cure is, all right, follow me. We pay physicians more money if they have a lower number. Genius. Genius. Number go up, number go down. Boom. That's it. That's it. You make people healthier by number go down. That's what we do here. That is actual gold standard science, guys. Don't get it wrong, okay? Oh my gosh. This is so crazy, guys. That's science in my book. Exactly. Down number lower, good. Lower good. Number lower.
Hello, everyone. Thank you for joining me today.
I'm sorry. What is the guys? I'm sorry. Okay, I don't know. Okay, I don't know what happened. What is happening here? Okay, but okay. Please, someone tell me what is happening right here. Is that what is this? What is that, dude? What is this tree? Is that a Christmas tree? Is that... No, dude. Renee, that's not petty. Like, you understand. Guys, you don't understand. Like, I spent so much time making sure, like, all of this is all set up. Like, making sure everything is all, like, you know, as someone that's on camera, like, you gotta make sure your backdrop is fine. It's like a dead tree, a dead Christmas tree, a minimalist Christmas tree, is this like, is it like it's a diseased Christmas tree? Do you know what I mean? Like, is it kind of like one of those things where you're like, this tree, after tobacco mosaic virus has like ravaged the tree, and now, you know, you're not looking too good. Your tree's not looking too hot. You know, is it one of those things? Like, what in the world, dude? That does not look good. That does not look good. I'm sorry. Oh my god, dude. Anyway, now let's dismantle all the healthcare industry, I guess. Like, here we go. Exactly. She doesn't have a green thumb. Exactly. She's feeling analogous. Exactly. That's what it looks like. You're just like, it looks like a dead Christmas tree. It just looks like a dead Christmas tree that's just been up for forever. Oh my god, dude. Exactly. Success, empty tree, empty mindset. There you go. Okay, all right, guys. We are 40 seconds in. We have got to lock. Oh my god, it's midnight. Oh my god. This is going to be a two-parter. There's no way. This is a two-parter for sure. Okay, guys, I'm so sorry. It is a bit long. It's an hour and a half. All right, yeah, this is the unvaccinated tree, guys. That's what I'm saying. This is a diseased tree. Oh, I'm sorry. Do you know what's weird is that my clock on my computer keeps like going back. I don't know why. Set the time zone automatically. Boom, boom. Thank you, guys. Okay. Well, we have enough. We have an extra hour there. Okay. Thank you. Anyway, don't listen to me, guys. I can't even get the time zone right. All right, here we go. Look at me. Listen to me. I have a lush green fake tree here. I have it's a fake lush green palm fronds. No, it's not a palm. It's like I don't know. Marissa, 7 calls today regarding removing the degrees from the professional list. Yes. Yes, Marissa, you're awesome. Thank you so much. Guys, 7. We're up to 680 now. Marissa, give it up for Marissa, guys. Let's go. In 3, 2, 1. Yes. Dude, guys, go to action.drgregshow.com. That's what Marissa did. She went there, and then she made some calls because of our call template. It makes it easy, it makes it fast, and you can actually combat people that can't take care of trees and just have twigs. They put lights on twigs. Guys, that's what these people want to do, okay? MAHA wants to get rid and ban Christmas trees, and they want your kids to be having a Christmas under a Christmas tree that has no leaves on it. That is the future that they are creating for you, and that this is the future that they want for you. And we say no. We say no to that Christmas trees can have leaves, that kids can have pine needles in their Christmas presents. And we, as scientists and as nursing and medical professionals, we all want you to have to clean out your vacuum every year because of the pine needles that get bunched up, much like vaccine needle waste bins. And that's what we're fighting for. That is the future that we want for you, so that your vaccinated kids can get stuck in their feet with the pine needles, and you go, "Ow, what is that?" And you're like, it's just a pine needle. That's the future that we want for you and your family. So that's what we want. Okay, guys. Oh man. I did only 2 emails from the scripts, but it's super easy and quick. Ex-Cult Girl, let's go. 682, guys. You're awesome. Let's give it up for Ex-Cult Girl. And 3, 2, 1. Nice. Ex-Cult Girl, you're awesome. All right, here we go, guys. We are 40 seconds in. This is not going to go well for us. I'm telling you, this is going to be a long night.
Today's episode was with the amazing and phenomenal Cynthia Nevison.
Oh, it's way too many
I found
words.
Cynthia on a colleague's page. He was talking about her research on
colleague.
autism, and I was just blown away with her work.
Blown away.
She is not somebody easy to find for sure. A very difficult person to tackle down.
What?
But after weeks and weeks of doing research, I found her. I emailed her, and she kindly accepted.
Guys, they are throwing around the R word way too much here. Okay? That is not okay. That is not okay. That her using the R word like that is a smear, and I will not. She's not allowed to take it. She's not allowed to use that word. She does not have R word pass. Okay, and I never want to hear her to say the R word ever again. All right, that's very important to me.
My invitation, in which I'm so grateful for. In this episode, we are going to talk
Thank you,
about
Susie, for all the gifts. Thank you.
And do vaccinations really cause autism and other delays in children? And what are these vaccines about? What are these ingredients?
What are these vaccines about? What's the deal with seatbelts? What's the deal with helmets? Like, what are you talking about? Yeah, exactly. What's up with that?
Is about, and how do they affect children, and why do they affect children, and why are we being pushed to vaccinate our kids, and why are we being punished for not vaccinating our kids. Her research is wonderful. I don't want to get too much.
There's
into
one
the
paper.
info,
She doesn't have
I don't
any
wanna give
research.
away what we talked about, but I think this episode is really an eye-opener for anyone that's processing vaccinating or thinking about vaccinating or is afraid and isn't sure about the information. Some things that we dived into was disturbing, and my goodness, I mean, it's such good knowledge, and I'm just so grateful for the many evidence-based, peer-reviewed articles that Cynthia has published.
She's done one in one paper, and everything else is on like nitric oxide levels in the atmosphere. Like, what is she talking about? Also, what kind of psycho points your camera directly into the neighboring window like this in the middle of the day? How do you not know to face the source of light? How? What kind of? What?
And they're wonderful, and she's dedicated her life to
Not-
being a mom, and
She's dedicated her life to being a mom. What? You don't have a choice of being a mom once you're a mom. That's the whole point. You're a mom. You're a mom. You're a dad. You don't choose to dedicate your life to becoming a mom or a dad. You are a mom or a dad once you are, and then it's whether or not you're a deadbeat mom or dad. That's the... You are a mom or you are a dad, and it's whether or not you are a deadbeat mom or dad and choose to not even think about that anymore.
I love how empathy she has and sympathy she has for people, and the drive that she has and the love she has for children, that she has dedicated so much time into this research on autism and vaccinations. So definitely something
Dude, like
for
nothing.
all parents,
331
whether you are
videos.
vaccinating or you are thinking about it or you're not sure. This episode is really gonna help you put things into perspective, as it has for me. So enjoy and make sure to subscribe to the channel.
thank you,
'cause it's
Carol.
immense support, and enjoy this episode with the amazing Cynthia Nevison.
Hello, Cynthia. Thank you so much for joining me today.
Wow.
Oh, thank you for having me.
Absolutely. It is such an honor to be in your presence. I adore your work, but I have
Let work, guys. Let work. What are you talking about? What are you talking about? Like, for real. Like, what are you talking about? She's an environmental toxicologist and she's really interested in the nitric oxide levels of the atmosphere? That's who she's talking to right now? A huge fan of your work.
to tell you, you were not easy to find. I think that's one of the things that you asked me too, right? You're like, how did you find me?
Yeah, you wrote me in an email.
No, because she's an obscure paper that was posted 11 years ago that's gone nowhere, that nobody references, and it's completely obscure because she hasn't done anything in that space.
Account that I almost never used. It was
Yeah.
funny.
Crazy,
I was
dude.
Like, I heard about your research through Dr. Toby.
Dr.
And
Toby.
I love your work. I think it's phenomenal and it's so meaningful. And when I was hearing him go through it, I said, I have to find this woman and I have to sit down and talk to her about this, because not a lot of research is out there about this, first of all.
What?
And secondly, I feel like people are not really open to talk about this. We're so scared to talk about vaccines. We're so scared to talk about autism.
Oh, yeah. Yeah, definitely. Nobody ever talks about that, guys. Nobody ever talks about this. Guys, this is in December of 2024. So this is after the election. So like, you guys never heard anyone talking about vaccines prior to the election? Who is Dr. Toby? We have to figure that out. I don't know. Who is Dr. Toby? That is an interesting. Dr. Toby, anti-vax. Written statement by Toby Rogers. Vaccines didn't. Okay, so yeah, it's.
Was 1,421. If the death total.
Toby Rogers, yeah, this is definitely it. Okay.
So I'm very grateful and
Tobias
I'm so
Fugate.
thankful that you are doing this research, or you did this research.
Yes, no, I appreciate that. And I agree that we haven't really had these conversations. And I guess I'm just feeling today very heartened by the nomination of Robert F. Kennedy Jr. to be the Secretary of Health and Human Services. And I guess I really thank you for the opportunity to kind of present my side of the story. And I feel like the time is
Of the story.
here.
She's at least she's right there. It's just a story. She has no research. It's just a story, guys. Hey, at least she doesn't play her research. She's not talking about this as like a phenomenal finding or anything.
To actually have an open conversation.
Oh, Marissa, if you guys are coming in late, okay, so we actually read the thing that they are posted today on the CDC. It's straight disinformation, and it's awful. And even the thing itself has to say, vaccines do not cause autism. Even the CDC disinformation website about vaccines and autism that show that there is a link has to have a disclaimer on it that vaccines do not cause autism, by the way. And in one of these studies that they were linking here, it was actually this discredited nonsense Word document that was uploaded and somehow got published in an environmental toxicology lab, an environmental health paper about this, a single author study. And we found out that she is an environmental toxicologist, has no background in medical science whatsoever, writes a scathing, correlative, unfounded paper. And in doing research and finding this person, we found that she is on a podcast here 11 months ago. And now this is what we're doing. Exactly, Marissa. They're not just allowed to lie, but guess what? We were actually clicking the links that were on the page. And even those links do not say what they say. They don't say what they say. They're lying about even the papers that they're linking. So it's just infuriating.
About these issues. So I'm going to speak as honestly, and openly as I can. I will tell you what I think, what I know, what I don't know.
Wow. She's going to tell us what she doesn't know.
The research could go to help
what a truth sayer.
shed light on this topic.
Wow.
Yes, absolutely. What a perfect time to talk about this. I feel so free and more comfortable now that we have a new presidency and a new team. I don't know. Do you feel like that too?
Wow.
I feel
How
more
brave.
comfortable to bring this up.
How brave, guys.
Absolutely.
Wow.
Absolutely. Yeah. If the election had gone the other way, I think what I would say today would be quite different.
Oh my gosh.
Oh my gosh. Wow. More exactly. More comfortable to lie. It's like
And another thing that happened quite recently was there was a paper on autism that came out maybe 2 weeks ago, and it was a lot of HMOs, a lot of them in California, Kaiser, mental health networks, and they were presenting new findings on autism. I was actually asked to comment on this paper, and the way it was presented in the news was still sort of following this better diagnosis narrative, emphasizing that rates among adults were increasing, and kind of the implication, I think I wrote it down, a quote from the paper is increased advocacy and education may be bringing autism spectrum disorders out of the shadow, encouraging more openness among Americans to get themselves or their children screened for the condition. But when you actually go into this paper and look at the data, which is, sort of what I do, and they did present
Wow.
the data.
She's so
We're
brave.
looking in the youngest birth cohorts, which were around 2020,
Oops.
likely autism rates of 4.5%.
Oh no. Is the vaccine information that the CDC is actually linking here because all the YouTube links have this vaccine information from the CDC, or what are they doing? Okay. Oh my gosh. At least the YouTube stuff are, oh my gosh. This is one of the old July 2024 things. This is 5 reasons it's important for adults to get vaccinated on the CDC website. Guys, they're gonna change that. This is a huge problem, but this, because a lot of these social media companies are now abdicating their role of kind of like, saying that they're actually doing things. Yeah. So I feel like this vaccine information, like pin from on YouTube, that is like going to be rife for disinformation now. They're going to pin this insane. Oh my gosh, guys. All right, we're going to go 1.2 speeds here.
And that means about 2% of girls and 7% of boys, because boys are most of the cases. And, nothing, they barely said anything about that in the, the press releases of the paper. And
what?
Still talking about better diagnosis. And I think we really need to start addressing
I agree.
these issues, because we're looking at very substantial percentages of our children who are being affected now.
I agree with you. What percentage did you say was boys and girls?
Well, autism has been about 80% of the cases are among boys and 20% girls, and I think that ratio is kind of narrowing a little bit, and there's slightly more girls being diagnosed. It used to be more of a 4-to-1 ratio, and it's moving toward.
If it's just an environmental risk, and it's from the air, and it's from the food, and there's no genetic component. In what scenario would there be 2.5 times more men than women getting diagnosed? That doesn't make any sense. They breathe the same air. Yeah, if it was environmental, it'd be 50-50. Like, what? That doesn't make any sense, dude. That doesn't make any sense. Exactly. It makes no sense at all, and that's a weird conclusion. Exactly. They can't even keep their own logic straight on their own thing.
3-to-1 ratio in this particular paper. I don't think that was the case in the latest CDC study.
Yes.
But this is more recent. This is more recent birth cohorts that they're looking at.
Yeah, I'd have to agree with you. Before we dive into all the juicy questions and all the good stuff, I really would love to get to know you more. And I'd like to ask you, how did you become interested in autism?
That was something that developed around the time of the birth of my first son, and there were a number of events, but 2 that stick in my mind in particular are that one, I happened to read a story about a newspaper article about the CDC's ATOM report, which is a biannual report that they put out on autism prevalence, and it just so happened that was the first report. It was published in 2007 in February, and it said that 1 in 91 boys was being diagnosed with autism.
Yeah, are the vaccines morphine or are girl genes? It doesn't. Yeah, exactly. Yeah, we are. Yeah, we are, Mindy. This is a podcast for an anti-vaxxer that's being cited by the CDC now.
And as I've learned in the meantime, those studies there's a big lag time before they publish them. So they were looking at kids born in 19.
Ratio is still 4-to-1 boys to girls. Dr. Mommy, is there a hypothesis for why that would be? Is that like more of a like institutional bias, like with like what like the traits that are autistic are more seen during like boys than girls, or are girls like I don't know, developing differently at different time points, or I'm actually curious what the actual medical hypothesis for that would be. Yeah, exactly, souls.
92.
Exactly.
So if I had actually known the numbers for the boys born in my son's birth year, the numbers would have been 1 in 35. But I didn't know that then.
1 to 35.
But anyway, I asked a good friend of mine was a special ed teacher, and everything I knew about autism, which was very little, came from her because she would sometimes tell me anecdotes about her students. And anyway, I asked her, gosh, I just read that 1 in 91 boys is being diagnosed with autism. What's causing this, and what can I do as a mother, expectant mother, to protect my son? And
Protecting my kid from autism instead of wondering, how do I protect my child from the 30 different diseases that the vaccines protect us from? Like, maybe like you should be worried about that. I don't know. Maybe she worried about the viruses and the diseases from that, not autism. I think there's a lot, a lot worse things that can happen to your kid, lady. Oh my gosh. Yeah, exactly, Marissa. I'm curious because especially at that age, girls are a lot different, like maturity wise, so it's yeah, we are shedding. Yeah, you guys are autism shedding. That's so funny. Nice, Bobby, you're awesome. Well, 11:30, guys, give it up for Bobby. In 3, 2, 1. Bobby. Good job, Bobby. Bobby. All right, guys. We're going to
knew I was having a boy at that point, and she said, well, nobody really knows what causes autism, but the lead theory is that more nerdy men and nerdy women are intermarrying and thereby producing genetically autistic children. And that just sort of struck me as an odd explanation, but, I accepted it. This is what she was hearing at national conferences. She was a special ed teacher who went to conferences on the topic, and that's what they were telling her.
She's a special ed
and then
teacher.
the second incident occurred less than a week after my...
She was a special ed teacher. I thought she was talking to her physician. Her pediatrics. What? She does homeschool, I guarantee you.
My son was born, and I was in a grocery store, and a nonverbal, very well-dressed, beautiful little boy, probably maybe 7, 8 years old, had a tantrum, like right at my feet.
Oh,
and
no.
he was nonverbal.
A tantrum?
Eventually his sister came and just carried him away.
That never happens. Guys, I'll tell you, a 7 or 8 year old having a tantrum, that never happens unless they're autistic. Oh my gosh, that would never happen. Wow. Oh my God, what a crazy thing that she witnessed. She's completely changed her entire life trajectory because she saw a child do a tantrum. But here we go. This is a harrowing story, guys. She actually encountered an autistic child in the wild, and the child had a tantrum, and she did everything to do in her power in order to protect her child from ever having a meltdown ever in the future. Wow, what a brave researcher speaking truth to power. Underdiagnoses or delayed diagnoses in girls. Okay, yeah, Dr. Mommy. Okay, interesting. Okay, thank you for that. I appreciate you. It's always nice to have physicians in the chat, guys. Thank you so much for being here. Never tantrum. Yeah, see, Hazel? Yeah, there you go. Never seen a tantrum before. Famously, guys, this is real. You gotta listen to me on this stuff. Famously, tantrums actually never existed in my parents' life. My parents have never seen a child tantrum. It's just tantrums only since the year 2000 and all the increase of vaccines. It's true. I know it's wild. Nobody believes me, but it's actually a new thing, famously.
And that really unnerved me.
Very modern issue, exactly.
And I, between that and my special ed friend's explanation, I started paying attention to the issue.
Thank you, Dr. Mommy.
And I guess
wait,
I
no, that's no way. The story really does end there. I was kidding. Listen to her. She really does see that tantrum, and it really does change her. No way.
And my special ed friend's explanation, I started paying attention to the issue, and I guess, you know, I'd seen the Rain Man movie, and that was pretty much all I knew. My friend would tell me anecdotes.
Wait. Am I going crazy? When did the
Of me, and I, you know, between that and my special ed.
Am I going crazy?
Very well dressed, beautiful little boy, probably maybe 7, 8 years old, had a tantrum like right at my feet, and he was nonverbal, and eventually his sister came and just carried him away, and that really unnerved me, and I, you know, between that and my special ed friends.
That's real. That was real. She really did just see a kid tantrum, and it unnerved her, and it changed her life. That was it. Oh my God.
I started paying attention to the issue, and I guess, you know, I'd seen the Rain Man movie, and that was pretty much all I knew. My friend would tell me anecdotes about her students, and I remember one in particular where she mentioned a girl who had a problem with constipation, and in her view of the situation, the problem was the girl psychologically could, quote, not let go. You know, so again, she was being told this autism is all sort of psychological, it's genetic.
What? Because a kid was constipated? Yeah, exactly, Amelia. Like, what? Lady, that happens all the time with kids. That happens all the time with kids. They get constipated because they get that feeling, and it's kind of like something that they're afraid of. So then they hold it in, and they don't want to poop in their pants. You know, especially if they're learning how to potty train. So they're gonna be self-conscious about that, and then they bottle it up, and then they get constipated, and then they try to have it. You know, and it doesn't work. Like that is like what happens with child, like that is, guys. Oh my God, imagine people believing this. I can't imagine this host right now that's like, I don't know if she's ever had a kid, and she's thinking about this going like, dang, wow, this is really harrowing.
But knowing what I know now, I mean,
Did you hear what the host said? Oh my God, that's awful.
that poor girl probably had a gastrointestinal problems, which many children with autism do.
What?
And I guess here we come to the part of the story where I'm going to bring up the taboo subject of vaccines.
Guys, that's wild, dude. You like, okay, like, okay. Look. I don't think that she should have become a mom. That's just what I'm gonna say. She obviously, these things, I saw like this TikTok of these people like putting milk in their mouths and then going up to their partner and just like letting the milk dribble out, you know, and seeing if they were ready to be a dad. You know what I mean? And it was, you know, watching the guy's reaction was hilarious. But guys, like, you know, have a dog first, you know, pick up the poop and all that kind of stuff, you know, because one, it's like you're going to have to deal with a lot of poop when you're a kid, when you have kids. All right. You're going to have poop on your hands. It's going to get on them. They're going to give you a hug, and you're going to be like, what is that? Why have I poop on me? Like, what, you know what I mean? We have a game at my house saying, is this poop? Like, what is this? Like, what is this? This is not okay. You know, not because, you know, obviously we clean it up constantly, and we, you know, they're not walking around with that stuff, but it happens because they have diapers on and they're taking off their diapers, they're playing and the diaper fails and there's poop there. You know, it's like, come on guys, like that happens all the time. Like that happens all the time. If a little bit of poop weirds you out enough, I would not, there's too much going on. You got too much going on in your life. You got to relax a little bit. Maybe not being a parent is a good role with you. But the idea that she literally had, this is all started with that child giving a tantrum Oh my gosh, dude. What that it's like dude, it's literally that meme where it's just like little boy doesn't get toy at the grocery store and the domino, and then it's just like all the big dominoes, and it's like vaccines are banned. And it's like that one kid, if that one kid just got their toy, none of this would happen. None of it. We would have vaccines. We would be in future space gay communism by now, and we would never have to worry about any of this stuff. But now, because that one kid had that one temper tantrum because he didn't get he got the M&Ms instead of the M&Ms with peanuts, and that was it. Now we have to deal with it. Yeah, exactly, Juliana. Yeah, it's they're hysterically crying. They're not even, the idea that they're nonverbal. They can't even breathe. You're like, chill, dude, chill. Like I do, my thing. I do breathing exercises with the kids, like. I'll give them a hug, and then I'll just like console them with the hug. So then we just breathe together. Like, I'm not even talking to them yet. We're not even discussing anything. We're just, and they can just feel that like radiating energy come into them, and they're just like, it's okay. Like they're not talking at that point. My child crashed out and wasn't able to have a rational conversation with me. Exactly. Oh no. Oh no. And that's why we banned vaccines. Like, what? But user, he's also well dressed. Give it to him. He's also well dressed. So there you go.
So I took my 2-month-old son to his first well baby visit.
Oh God, 2-month-old guys.
And I thought, well, we'll probably get some vaccines, and I knew about polio and DTaP, and I was okay with those. But I was just kind of, and I'm an older mom, I was just kind of, taken aback by how many shots they wanted me to give him. And we ended up getting, like, it was one shot, but it was a bundle of 5 different vaccines all in one. We didn't get the other 3 that they wanted. But even with those 5, I just came out of there feeling intuitively very uneasy about what I'd just done, what I had allowed to be done to my little baby, and he was kind of on the small side. And I remember really thinking, I need to inform myself on this issue before we go.
What's with these guys and like the size of needles and how small their kids are? They're really weirded out by that. They really have no idea what an IM shot is. It goes into the muscle, guys. It goes into the muscle, and they don't normally have, they're not doing it in the shoulder because of, they don't have any deltoid that's created yet. So they're just like right into the thigh. They just right into the thigh. So you have to have like a good sized needle, man. Like it's just wild to me. They've actually decreased the amount of antigen that they give in these shots, so that it allows them to actually give more shots at once. So it's less of a burden for you as a parent to go there. So you don't have to go there every 3 months. You can go there once every 6 months. Like, why is that bad? Like, it's insanity. Exactly, Night Flyer. Oh no. Oh no. And you can space them out if you wish. Yeah, Dr. Mama, you can. But that is not that alternate testing isn't tested. You know what I mean? That's the thing. Is that like we have the required one, or the one that's suggested, is the one that's tested, because that's the one that immunizes your baby as soon as they can. That's what you do. The baby is the most susceptible and the youngest, so that they, that you don't want your kid getting sick. Like, come on, that's like right. That's crazy. Yeah, exactly. As soon as you get him in the right time frame, that makes sense. Exactly. Not as many co-pays if you combine them. Yeah, that's not it.
Go back to the 4-month visit, because you're supposed to go at 2 months, 4 months, 6 months. Right. And I was vaguely aware there'd been some sort of controversy about autism and vaccines. I I thought it had been thoroughly discredited, but nevertheless, I wanted to, find out what was the basis of that.
Yeah, I mean I think that's fair, Dr. Mami. I mean, honestly, if that is the reason, you know what I mean? If that's what they're thinking, I agree. I agree with you. Like, it's like, why fight it? You'd rather get it and do the alternative schedule that isn't tested, but that still gets them vaccinated versus pushing these people into anti-vax groups. You know what I mean? So it's like I totally agree.
Controversy. So I went to the library, public library. I checked out Evidence of Harm by David Kirby.
Oh my gosh.
And
She
I
went
read
to the
it.
library.
Pretty much that's all I did for the next 3 or 4 days was I read that book. And that's
What is this book? Oh my God, guys. Evidence of Harm book. Mercury and Vaccines by David Kirby. Oh my God, guys. What? What? That's what she said, right? Evidence of harm? Oh, it's not the same person. Wow. David Kirby, here it is. Oh my gosh. A medical controversy. This guy literally getting paid. So glad I found this book on library shelves. It's a perfect example of how library resources are not always credible. I will use it in information literacy instruction and ask students to contrast it with more recent scholarly articles on the topic. 1 star.
how I learned about the group Safe Minds, which at that time was founded and was kind of focused entirely on the issue of mercury in vaccines, because there was mercury in the shots, which were taken out by the time my son was born. But throughout the 1990s, kids were getting a lot of mercury in these vaccines. And
so once that was done and thimerosal was taken out of vaccines, we famously don't have any more autism, because that's was the cause, and they were, right? 1 second. Wait, I'm sorry. My control room's saying, no, that's not right at all. Obviously, thimerosal didn't cause autism. These people have no idea what they're talking about, and that never was the cause of it, because we took it out and vaccine and autism rates didn't plummet. So again, just nonsense, dude. These guys have no idea what they're talking about. It's wild to me.
this Safe Minds was a group of parents that was focused on mercury. But anyway, I learned about some of their stories and what they were dealing with
Exactly,
autism, and it was
Nightflyer.
really quite heartbreaking, especially the kids with GI issues that were really physically suffering.
Dude, this chick is way too interested in baby poops. I'm just gonna tell you right now. I don't understand. Like, it doesn't make any sense, dude. It's very weird.
And I subscribed to their newsletter.
Wow.
And then I had a second son, and that pregnancy was 2008, 2009. And it was probably in fall 2008, I went to a wellness check.
Guys, like, I don't know what happened with her kiddos, but like, it seems like she's having these babies like past 40, right? She's a 2-year-old, 2005. She's probably in her 60s now. Looks like she's like having her babies into her 40s. These are high risk pregnancies, guys. Like Yeah, Juliana. She's saying that like because autism kids have. That's what she's. Yeah, she is. Yeah, she is saying to say that.
Up for me with my OBGYN. And I remember her saying, well, you need to get a flu shot. And that hadn't happened with my first pregnancy, which was 2006, 2007. So I think it's sometime around that point they started promoting the flu shots for pregnant women. And so I liked my doctor, and I didn't.
What? Flu. When did flu shot recommendations begin pregnant women? Recommendations for the flu shots for pregnant women began in the 1960s in the United States after a major flu pandemic. The routine annual vaccination became more of a priority in the 1990s. Just like 1960s, the Surgeon General began recommending annual flu vaccination for pregnant women in response to flu pandemics that were associated with mortality risk. 1997, pregnancy was formally added to the ACIP list of high-risk conditions that require routine annual vaccinations. 2012, the WHO issued a global recommendation for flu vaccination for all pregnant women, highlighting the benefits of providing protection for both mother and the newborn. Is that anyone? Are we just the single thing that she could be right about? Just a single thing, come on. She's the expert here, guys. All right, stop. I won't have any of you coming. I won't let you guys come after my fellow ecologists, okay? I won't let you guys attack her. That's not okay. All right? We ecologists are scientists too. And we have the whole wealth of knowledge about everything. Humans are a part of the ecology as well. And if, so she's, don't come after us, okay? The U.S. has the highest maternal mortality rate among developed nations. Why become a statistic? Yes, exactly, Marissa. Like we do some things incredibly right. Like why do the things that make us on the lower end of the number range? You know what I mean? Exactly, Bobby. I'm sorry.
Really question the vaccines that much, and
wow, what a brave! She's
so
brave.
Down to the lab to get the shot, and then I happened to ask at the front desk, because I'd read the Safe Minds newsletter. I said, "Well,
wow.
Is there mercury in those shots?" And she said, "Well, yeah." And
they're taken out. No, it's
right.
not.
So at that point, I just left the building.
Thimerosal is only in MMR now, guys. It's only in MMR. It's not. It's as a preservative. It's. Again, dude. Like just. It's not mercury too. It's thimerosal. It's different. There's different forms of things. Okay. It's the dose makes the poison, guys. I know, Bear. Exactly.
Didn't look back.
She's so brave. Wow.
And however, I think at the time, if there hadn't been mercury in the flu shot, I would have gotten it.
Again,
on my
not true.
doctor's advice.
Not true.
But what I know now is it's really not just mercury. It's the activation of the maternal immune system. We have these sentinels, for lack of a better word, on our white blood cells called toll-like receptors, and when they sense, when they sense a pathogen is present or a vaccine, which is known to stimulate them, they go into a inflammatory mode, and that alone is not great for the fetus. It's not great to be.
Your baby gets antibodies for something that's in the area that the mom is making an immune response to. Why would that be a bad thing? I'm a microbiologist. So, why would that be a bad thing? Oh, nice, guys. We did it. Nice. Why would you that's a good thing to get the get antibodies for something that the mom is going through. That's a good thing. That doesn't make any sense. Why would that be bad?
stimulating a mother's immune system during pregnancy. So it was probably lucky for me that I was so focused on mercury. All I knew was that it was mercury was the only problem at the time, because I probably would have gotten a shot.
And she's wrong with that. So the only thing that she knows, self-admittedly, she's wrong on. So she has no idea what she's talking about, even by her own admission.
And I'm glad I didn't. And I did think, that's kind of weird that they're recommending pregnant women get injected with a neurotoxin. And
nope, not a neurotoxin. Not true. Not true at all. Again, guys, doesn't make any sense. I believe so. Yeah, I believe so. The whole point is that they do get like some of the antibodies. I think so. I'm not 100% sure. But I think so. Do antibodies from mom get into baby's bloodstream? I'm not 100% sure. I don't know. Yes, antibodies from the mom get into the baby's bloodstream, both through the placenta during pregnancy and via breast milk after birth. So, yeah. What are you talking about? We are dismantling this person's whole worldview that is being used and accredited to attack vaccines nationally in the United States, making us a laughingstock and hurting our ability to deal with current pandemics, future pandemics, hindering public health, increasing disease, and defunding science based off of their lunacy. That's what we are doing right now. Thanks for being here.
Since then they've added a lot more shots.
Yeah.
It's like open season on pregnant women now, and
It is a threat to national security.
The effects of that.
Yeah, absolutely. So basically all these experiences that you were exposed to with vaccines kind of allowed you to process things a little differently and research more about what they're putting into your body. So it's your personal experience of it.
Dude, the host has overfilled lips so much, dude. Look at those. Jeez. Do less.
More about what they're putting into your body. So it's your personal experience of it.
Well, it was just sort of a slow, it took me many years to come to my current understanding. And it's a very slow process because I was just like anyone else who didn't question vaccines. And if my doctor told me to get one, I would get one.
Yeah.
That's how I used to be.
Yeah. I mean, until you kind of learn and question.
Hey, Brittany, she's a strong Christian woman, okay? Don't. She's just became Christian December 11th, 2024. So it's the day before.
Things, but I love how you talk about the motherly intuition. Like it's just something in your body that was telling you, hey, like don't come back, don't do this to your child anymore, go back and read about it more. And I think that's one of the things that we miss as women and men too sometimes, that we don't really look for that. We don't listen to that inside voice,
Right.
Oh, Mama T, mind, body, and spirit. Oh, exciting. We have a truth sayer in chat, guys. Woo! Thank you for being here. Thank you for helping us find the truth.
No, I think the maternal instinct is, I think Dr. Andrew Wakefield has said it's the steady hand on the tiller that has guided human evolution, and we need to listen to it.
Absolutely. How did you start?
I have looked it up. We have looked it up. We have studies. You don't live lobotomy. You don't just Google aluminum, bruv. You go and you read studies, and that's how you become scientifically minded. And the biggest one that we know of to dates is this one right here. And this one is awesome because they checked that. Aluminum absorbed vaccines and chronic diseases in childhood. And guess what? It isn't connected to anything. Vaccines are safe and effective for kids. 25-year study, 1.2 million kids. All safe. So there you go. Why don't you use your Google to look this one up? There you go. Yeah, they're absorbed because they're shot into your arm through an IM injection. So that's how, yes, that usually, that's how it happens. Absorbed? Yes, yeah, they're absorbed, yeah. What else word would you use?
Publishing papers on
Yeah,
autism.
graphene, exactly. There's actually more aluminum in breast milk than there is vaccines. And yet you don't see these people trying to ban breastfeeding. Why don't you look that up? Mind, body, spirit. There you go.
We wrote quite a bit, so talk to me a little bit about that.
Wow, you wrote quite a bit.
Right. Yeah. Well, so I had been subscribing to the Safe Minds newsletter for a number of years. I had two young children at this point, and Safe Minds put out a call. They wanted to volunteer with a background in atmospheric science, which is what I have.
Oh, okay. Okay, so this is the paper, guys. This is that paper. So she's asking, like, you wrote quite a bit. And she's like, you wrote a full paper, and she's just a single author, had no idea what she was talking about. And now she's like, oh wow, I get to talk about it.
To look into the issue of air pollution, especially atmospheric mercury air pollution and its correlation to autism. So I sort of dived in and I volunteered for the project, and that project acquainted me with the
Dr. Rubin is a great expert. He is a allergist, physician. He's awesome. If I wrote on one paper,
available autism prevalence data, and so with my study with atmospheric mercury,
nice.
I actually did find kind of a geographic correlation, but I became skeptical of my own study because it didn't really make sense. I mean, the amount of mercury in the air is minute. The trends, furthermore, have been either flat.
Wait, what? Is that just real? She doesn't believe her own study. She doesn't believe her own study that the CDC is sourcing as why we should ban vaccines. She doesn't believe her own study now that RFK is linking. What? How? Are you serious? No way! Are you serious?
Or declining over the same time frame that autism was increasing rapidly. So I was sort of becoming disillusioned with my own air pollution study, and sort of same time the trends. But I became
dude, you just came here, Mind Body. We read the Mind Body Spirit. We actually read the paper. So what are you talking about? Like you have no idea what you're talking about. You don't know what study she's talking about. You don't even know like the correlations that she was talking about. And you're telling me what she actually believes? It's almost like you just kind of like make things up on the fly about mind, body, and spirit and all the time. That's crazy. Wow, it's almost like you have no idea what you're talking about. Wow.
And so with my study with atmospheric mercury, I actually did find kind of a geographic correlation, but I became skeptical of my own study because it didn't really make sense. I mean, the amount of mercury in the air is minute. The trends, furthermore, had been either flat or declining over the same time frame that autism was increasing rapidly. So I was
Okay, so atmospheric mercury going down, autism going up. All right. How does she get it? This is mind, body, spirit has an interlocked. She's locked in, guys. So let's see.
I was sort of becoming disillusioned with my own air pollution study, and then I think it was 2012, a group from Johns Hopkins published a paper with a list of the 10 top toxins that cause autism.
Okay.
And then leading the list was lead, which was largely phased out starting in the 1970s. Things like DDT, which was banned in 1972. PCBs, which had also been, banned or phased out. air pollution was up there, and they also listed, I think, very, sort of sneakily or disingenuously, methyl mercury. Everything else had been like a broad class of compounds or the entire element, but here they were specifically listing methyl mercury, and it was clear the reason why, because ethyl mercury is the compound that was being put in vaccines. So that's fine, I guess, according to this study, but methyl mercury was one of the top contributors, and that's the form.
Yeah, exactly, Marissa. She found her original conclusion not correct, and she literally was just like, what else could I find here? And what else could I correlate to something? And oh my gosh, I found something else that I could correlate with it. And then now she's like a genius in her own mind. That's insane. I just, it's so embarrassing. And what is this nonsense that methyl mercury is? Like, what? I thought it was thimerosal that was in vaccines, not methyl mercury. Like, what is she talking about? It's just like, how? I just want to go back.
More found in fish. Ethyl mercury put in vaccines. So here the reason why, because ethyl mercury is the compound that was being put in vaccines. So
ethyl mercury. Okay, ethyl mercury. Okay, the main source of ethyl mercury is thimerosal. Okay. Okay.
that's fine, I guess, according to this study, but methyl mercury was one of the top contributors, and that's the form more found in fish.
Yeah. Okay. So wait. So yeah, methyl and no, she's changing it.
So on. So, but anyway, that I guess that prompted me to just write a paper looking at these 10 toxins and looking at their time trends. Because I knew I used to teach atmospheric chemistry, and I knew a lot of these things had downward trends, and it simply, just like my own atmospheric mercury paper, didn't make sense to be blaming a steep rise in autism, which I was seeing in the data, on pollutants that were decreasing in the environment at the same time. So I wrote a paper on this, and this was after nearly a 2-year struggle and probably 3 different journals, 5 rounds of peer review.
Nobody wanted it, and nobody believed her, and nobody wanted to run this. So they're just like, nobody wants to touch it.
Paper published. That was my first paper. And it was sort of an eye-opener to encounter the peer review process in the field of autism.
Yeah. She's shocked at that people like that want to peer review something. Yeah, there already are. Like, I mean, the biggest one, Dr. MC, is like this one. This already tests it, and this is the biggest one. So, like, it is tested. Yeah, currently the only vaccines that contain thimerosal as a preservative are recommended for children in the United States are certain inactivated influenza vaccines. Yeah. No, it is in there. Yeah. No, it is in there. For sure. But dude, like, the dose makes the poison, bro. That's the thing. Like, you know what's one of the most deadly compounds that we know of as humans? The stuff that we inject into people's foreheads to get rid of, like, you know, freaking Botox. So it's like a gram of that stuff can kill like 1 million people. So it's like, and we're talking about like nanograms or something of that. Is that what people use? You know, and so the idea that like it's the dosage, man. It's the dosage. So the idea that like this stuff is in there, it can be in there at a safe level, and they test it. Yeah, Mama, they do for stuff. Yeah, for Botox too. It's even more dangerous, and it's natural, by the way. Botox is a natural ingredient, right? There is no safe level of Botox? Is that what you're saying? There's no safe level of Botox? I think that there is a safe level of Botox. Do you know how many calls to poison control come from essential oil users? That's a good question. Wait. So you're saying that there is a safe level. I just want to get that right, T. You're saying that there is a safe level for the most dangerous and most deadly compound that we know of in. I'm certified in essential oils. There we go. That's all we needed to know. Thank you, Mind Body Spirit. Thank you. Wow, didn't know we had an expert here, and thank you for being here. I'm really happy that you're certified in order to handle your 1 to 1 million dilution of rosemary tincture, and I'm really happy that you went through your certification process, which is what? Let me tell you, we went to like Ralph's or Vaughn's, and then you went to the spice aisle, and then you took like a big pot, and then you just dumped a bunch of stuff in there, and then you're like, this is what medicine is. Like, look at me. This will cure cancer. Give me a break, dude. Give me a break. Embarrassing. I'm certified for. Give me a break. It's not good, DN. It's a cancer killer, okay? Does that make you feel good about yourself? You should feel shame. That's the problem, is that people like you don't feel shame. And it's embarrassing that you come in here and you actually try to harm people without any people shaming you. And this is not a safe space for you to just spout nonsense. I'm sorry. Like if you had genuine questions, degrading people is shameful. Exposing people to pathogens is shameful. Exposing people to disease is shameful. Creating an environment where kids are more susceptible to be living with disease and actually inherent maladies from these diseases that you guys are pushing is shameful. That is what it is. And you're a bad parent. I just want to let you know, since you are explicitly a mom and you are not vaccinating your kid, I just want to let you know that you are a bad parent. Okay? I just want to make sure that you are clear. You are a bad parent. Because you are not allowing your child to grow up in a world that is free of the diseases that you grew up in. You're creating a scenario where your child and your granddaughter is going to live and be exposed to diseases that are preventable, and therefore you are a bad parent for doing that. And I don't feel bad and guilty for saying that to you. People have lied to you, and it's not my fault for having to say that to you. Okay? That's not that people have lied to you. I am not lying to you. You can be a better parent tomorrow. Okay? You can be a better person tomorrow.
Some of the reviewers were openly disrespectful.
Yes, you're exactly, Amy. You're actively contributing to there being more sickness in kids. Exactly. You're spreading disease and sickness and malady and danger to more kids. It's not okay. No. Your granddaughter is not injured by vaccines documented with the government. No, it's not. No, you're not. That did not happen. That's not true. Okay? That's not true.
They felt they had license to insult me.
It's VAERS. It's not VAARS. Letting you know. Just letting you know that you can't even spell VAERS correctly. So just putting it out there. It's a Vaccine Adverse Effects Reporting System. VAERS. You'll get there.
Call me ignorant.
Yeah, sure.
It was only when they started to contradict themselves that I think the editor and one supportive reviewer took pity on me and my paper got through, because some of the reviewers were.
Is that real? Guys, just listen to this. Her trying to get this nonsense published, which was just an atrocious paper that we already read, and this is like the dribble that she's going, and she's literal. This is what our CDC, the paper that the CDC is now referencing in order to take down the entire medical industry, all of medical science. This is the author of this paper trying to get it published. This is what she had to go through in order to get this published.
Openly disrespectful. They felt they had license to insult me, call me ignorant.
Because it was a bad paper.
It was only when they started to contradict themselves that I think the editor and one supportive reviewer took pity on me and my paper got through, because some of the reviewers were saying
they took pity on her to publish it, and now we have to live with it, and now it's being sourced in order to take vaccines away from everyone in the nation. This is real life. This is actually happening. No, exactly, Amy. I've never got a pity publication in my life. It reminds me of Eric Weinstein's PhD. That he was a 10-year PhD, and he didn't have a single publication. Or is it Brett Weinstein? I think it's Brett Weinstein. This guy. Brett Weinstein didn't have a single publication to his name, didn't have any original research whatsoever. He didn't contribute to the scientific community a single bit. He used someone else's data, didn't find anything worthwhile in it, and after 10 years, they gave him a pity PhD, and they just said, "Get out of here, dude. Just get out of here." 10 years. Took him 10 years to do that nonsense. And now we have to all live with him. Because I don't know why.
well, you can't rule out a cause of autism based on a time trend. You can only identify toxins that might have the same trend, upward trend, and thus be more
correlation
positive.
is not a causation.
Whereas other reviewers were saying the opposite, that you can't rule out anything, or I can't remember which way I said. There was one school of thought that time trends were useful for ruling out toxins, and the other was no, that has no bearing, but you can at least identify toxins that are plausible. And my own opinion on is that the time trends are useful for ruling out toxins that really just don't make sense. That's why I wrote that paper. And
then by her own admission, thimerosal being taken out of vaccines, what is the trend that you're seeing? What are you seeing then? What is she talking about? I'll try. It doesn't look like she's had anyone on in the last 4 months. So apparently she's just given up on this podcast. But I'll try. I can try. I don't think. I mean, it's 300 views, guys. I mean, some of my views, some of my stuff is getting better.
Air pollution was uppermost in my mind when I wrote it, and I've been attacked for arguing that correlation equals causation, and that was not the main point of that paper.
That's literally what she did. That's literally what she did, guys. Isn't that what? Isn't she? We literally read the paper. I'm gonna keep saying it because it keeps happening. Reading gives you superpowers. Read, guys. Read. It's really that simple. Read. Just read, guys. Just read. Just read. That's it. That's honestly that is like, how do I battle misinformation? How do I read? That's it. That is the truth.
But also, another part of the struggle to publish that paper was that...
Exactly, Amy. Not the main point. It shouldn't even be a minor point. Exactly. That's why you do. That's why you do the experiments, to make sure that's not even a single minor point in there. Exactly. That's this is Amy. Listen. All right. I don't know what kind of science you're doing. All right. They don't know what kind of science I'm doing. All right. This is gold standard science. I want you to we need to watch and learn from a gold standard scientist here. All right. We can't just be throwing out words. We don't understand them. This is gold standard stuff. All right. We're in the Copper League. Okay. We're in the Bronze Age. All right. These people are in it. All right. These people are. This is the black and gold era.
I had to address the issue of the time trend because most of the reviewers I encountered, the peer reviewers, a paper has to go through a peer review process. Most of the peer reviewers thought that the time trends were completely irrelevant to autism causation.
Oh!
And that...
So the other scientists are like, this doesn't make any sense. And she's like, excuse me. I
just couldn't understand that viewpoint because when you look at the autism data, the most striking feature of it is the fact that it's increasing rapidly. So how can the time trends in the candidate toxins not be relevant? But it turned out that...
Because it could be a lot of different things. It can be a lot of different things. Like organic food sales. It could be a lot of different things. This is the scientist that's advising how we are understanding the world, guys. Get with it. This is good science. I feel like this is our Lysenko, guys. I'm like actually so... This is our Lysenko right here. She is driving us off the cliff.
A lot of the reviewers didn't think there was actually a true trend in autism. That was the problem. They thought it was just better diagnosis. So that kind of led to a series of papers where I just tried to look empirically at the data and show one way or another whether...
Okay, Amy. Okay. So, Amy, this person. Okay, so we started off reading. So someone came up and showed me this. Okay, so the CDC came up with this. Autism and vaccines, and one of the studies that they point here to is a study that actually points to vaccines causing autism directly. So we looked up the paper. This is the paper, a comparison of temporal trends in the U.S., autism prevalence, trends in the suspected environmental factors. A huge red flag here. As anyone can see, a solo paper on something this big. Very odd, guys. That is very odd. Normally, there's going to be a professor, there's going to be grad students, there's going to be postdocs. There's going to be a lot of people on a paper like this in order to do data science in order to this. So one person, and then we checked the affiliation, and the affiliation is the Institute for Arctic and Alpine Research in University of Colorado. As if, I don't know, the Institute of Arctic and Alpine Research is going to be the institution that has, or the research body that pushes this out. It's in environmental health. So again, another paper, another environmental health publication, journal, excuse me, a journal that has nothing to do with medicine, right? Nothing to do with medicine. And basically I looked her up, I found her, and then Cynthia Nevison